Good morning, everyone. This is Dr. Sadhra. Welcome on this good Friday morning to a presentation on stress. I'm so glad that you've taken your time away from your busy schedules to join me in this presentation. So what we'll be looking at today with regards to stress now, most people know the term stress. They know that lifestyle might help in some way, but these are kind of generalizations. So what we'll be looking at in more detail is what is stress? What is the definition? What actually happens on a biochemical basis within our bodies? How does our body internally respond to stress? And what are the effects when stress just goes on that a little bit too long? So acute stress, it could be beneficial, but long-term stress, is it as beneficial? How harmful is it for us? And what can we do about it by our diet, exercise, sleep? Now, it is well known that having a balanced diet is great for our stress. Exercise is great for stress, sleep. Well, how is it helpful? What are the mechanisms that are at play that help reduce those stress levels or help our ability to cope with higher levels of stress? And then we'll take it one step further and introduce a kind of novel new area of healthcare called epigenetics and see how that can tie in with stress as well. So the World Health Organization has defined stress, which I find is quite a good definition. So stress is our body's, ability to react to the environment around us, or if this could be something emotional, it could be psychological, it could be something physical, something happening around us. And it used to be, well, it still is a survival mechanism. Ancestors from thousands of years ago use stress in a very, very encouraging way to try and get out of dangerous situations. But the stresses we have nowadays are more long-term related stress, and we'll just look at the biochemical mechanisms at play as to what happens in stress. So stress, it starts off with the alarm reaction. So this is your kind of flight and fight response. So you're in a situation, it's stressful, and you want to get out of it. And so your body responds in a certain way. But as the stress progresses and it doesn't leave the situation, or our bodies struggle to get out of a situation, it turns into a more resistant stage, and then finally an exhaustion stage, which we'll explore in a bit more detail shortly. So the first biochemical part of our stress response is initiated by the sympathetic nervous system. So you have the stressor, which could be, workload, a bereavement, you've injured yourself, and that sends a trigger on to the hypothalamus, which is part of our brain. That then sends a signal to the adrenal medulla. So the adrenal medulla is situated within the adrenal glands, which sit on top of our kidneys. And that produces two catecholamines called noradrenaline or norepinephrine and adrenaline or epinephrine. And these have together a combination of the two produce a flight and fight response. So what happens to us from a physiological point of view when these catecholamines are released into our bodies? Well, if you think about ancestrally, you would want to get out of the situation, you want to run, fight or flight. So you would want to have more access to, your muscles activating a lot more quickly. That means getting more blood flow to them. And therefore your body increases your blood pressure, increases your heart rate, which then increases the amount of blood flow coming out the heart, supplying the muscles with a lot of nutrition, oxygen, and that helps you to get away from the situation quickly. It also increases glucose levels, so there's more energy available for those muscles to expend to help you get out of that situation. Lipolysis breaking down fats to produce even more energy. Increased oxygen consumption because your muscles are working a lot harder. Thermogenesis is essentially increasing your own body temperature, and that makes things move around a bit more quicker. And bronchodilators, which are your airways opening up a bit more, allowing more airflow to come in, and therefore more oxygenation. So it's all a very, very good response to try and help you get up and get out of a situation or fight off a situation. Behavioral changes, you get enhanced arousal, your memory improves, your alertness around you improves, the way you understand and react to your environment also improves, you become focused, and sometimes you get an analgesic effect, or you don't feel pain as much, and that's why after a shock or an injury and so forth, when the adrenaline wears off, you start to feel pain a bit more. It's because of the effects of noradrenaline and adrenaline, which help you get out or try to get out of a situation which the body doesn't like. The second stage, which is a slightly slower response to the stressor, is from the HPA axis, so hypothalamus, pituitary, and adrenal axis. So what happens here is the stressor, again, the hypothalamus engages in a reaction which produces corticotrophin releasing hormone, which then sends a signal to the pituitary gland, which is a gland that sits in the middle of our brain, which then sends a signal to an ACTH hormone, which is the adrenocorticotropic hormone. So it's a bit of an error. It's ACTH, not ACTCH. And that sends a signal again to the adrenal glands, which again sit on top of our kidneys, and they produce glucocortical hormones, which are things like steroids or cortisol that you may have already heard of. What happens then is your body wants to regulate the amount of response that the HPA axis is giving out. So the glucocortical hormones, when they're in enough supply in the blood, it starts to switch off or give a negative feedback to the hypothalamus, pituitary gland, and the adrenal glands, and the body's then saying to itself, okay, I'm aware that there's something not quite right, but let's turn the taps off a bit and let's see what we can do in this situation. But this is very, very important when we go into long-term stress, because there is a substantial impact on how this negative feedback process works. So what are the effects of these glucocortical hormones? They increase blood glucose. So you might find in diabetic patients who have had steroids for an illness, their blood sugars increase all of a sudden. That's because of glucocortical hormones. You see an increase in the effect of the epinephrine and norepinephrine, adrenaline and noradrenaline, on the cardiovascular system. It pronounces its effect. It suppresses the immune function and suppresses inflammation. So you might think to yourself, well, why does the body want to reduce our immunity or reduce inflammation in a time where it's fighting off something? Well, in actual fact, when you have an injury or something happens to one part of the body, you have a localized reaction which causes inflammation and causes an immune response straight away. And what then happens is, if there is no kind of shut-off mechanism to that, the inflammation will just carry on and carry on and carry on, and the immune system will probably overreact. So what these hormones do is to try and put a lid on that reaction and keep everything in check. So after the stressor has come about, and via these two mechanisms, the sympathetic nervous system and the HPA axis, what happens then is the body enters a recovery phase, whereby it starts to calm down, it lowers the steroid production, and the aim then is to improve things to back to what the body was like before the stressor came along, i.e. reducing your heart rate, reducing your blood pressure. But the body will always stay on alert until the stressful phase has passed, or that perceived stressor is not actually as harmful as it was once thought of. So what happens when the stressor doesn't go away? So, workload is increasing. You may have a team member or colleagues that you have to work with, which may increase your stress levels. You might be having something going on at home, a family member's sick, or financially. These are things you can't get rid of straight away. So what happens then is you get a continued secretion of the stress hormones, and that can cause poor concentration. It can lead to frustration, irritability, but the physical change in the response to stress remains elevated. So your blood pressure keeps at a slightly higher level. Your heart rate keeps at a slightly higher level. So you're always feeling a bit more on edge. And then finally, because you can't keep that level up for forever, you start to feel burnt out. You start to feel fatigued. Depression and anxiety kick in. This is probably due to a reduction in the serotonin and dopamine levels that are available, which are your happy hormones, reduced tolerance to stress, which we'll look at in a second, and a weakened immune system. So we know from the steroid production, it suppresses immune function, but if you allow it to continue to suppress the immune function, your immune system may become weakened. So what are the effects of chronic stress? What impact does it have on our health? Well, you've got increased blood pressure for prolonged periods of time, increased heart rate, and these can lead to an increase in the risk of cardiovascular disease, strokes, heart attacks, and hypertension. Gastric ulcers and bleeding. So with the suppression of the immune system, bugs like Helicobacter can proliferate within the stomach, which can cause inflammation, bleeding, and ulcers. Blunted cortical response to stress. So what happens is if you keep on getting a stressful trigger, your body builds up a bit of a resistance to it, so it's not as receptive to stress, and therefore your reaction to stress is a bit more blunted. Mental health disorders, so we mentioned depression, anxiety, and also psychiatric disorders. This is probably due to less availability of serotonin and dopamine, amongst other chemical changes that can happen within the brain. Chronic muscle tension. So when we are going through a stressful stage and our muscles are on edge, they're in a state of tension, ready to go. But obviously, as this tension builds up and builds up and builds up, almost like a spasm, that can lead to headaches, tension headaches, sometimes migraines, musculoskeletal disorders where you might find pain in several parts of the body. So conditions like fibromyalgia, symptoms might get worse because the muscles are a lot tighter. Reduced libido, and you can get menstrual irregularities, and that's because the hypothalamus and the pituitary gland are involved in regulating the hormones progesterone and estrogen, which can regulate the menstrual cycle. So how can we reduce our stress levels if the stressor is not going away, or how can we manage or better cope with these stress levels if the stressor is not going away? Diet, but how can we change our diet? Yes, we know what a balance, or our idea of a balanced diet, what that could comprise of, vegetable, fruit, but what specific food groups may help with stress? Exercise, how does exercise help with stress? Surely you're putting yourself under more stress if you're going through a vigorous workout. So how does that help with stress? Sleep. Now we all know sleep is very, very important, because when we've lacked sleep, we know the effects of it the day after or the days after. But how much sleep do we need? And why is sleep so essential? Socialization. So this is how you interact with friends, family outside of your workplace. Unhealthy habits. So these can be coping mechanisms. And work-life balance. So if you're work-life balance is not great, and you're spending more and more time at work, it can influence your lifestyle. For this presentation, we'll be sticking to diet, exercise, and sleep, because with socialization, unhealthy habits like smoking, alcohol, recreational drug use are things that one needs to seek further support for by their own means, and also try to reduce them gradually. Work-life balance, obviously, that can be discussed with managers or colleagues to try and see how that can be rectified. And socialization is depending on how much you want to interact with family and friends, or how often you plan to do things extracurricularly. So how can diet help with your ability to cope with stress better? Several studies in the past have shown that Mediterranean diet helps with reducing your cardiovascular disease risk. So there's been a bit of controversy about how those figures have been, the figures related to deaths from cardiovascular disease in Mediterranean diets, how they've been recorded. But generally speaking, the Mediterranean diet has been known to improve our cardiovascular health. And as we know from earlier on, chronic stress can increase our risk of heart disease through increased blood pressure, increased heart rate for prolonged periods of time. But also has an impact on our well-being as well, some studies have shown, having a Mediterranean diet. Magnesium-rich foods. So studies have shown that magnesium in low levels can cause fatigue and headaches. So fatigue, headaches can be a symptom of increased levels of stress. So salmon, soybeans, spinach, green leafy vegetables are all sources of food which have got a high content of magnesium. Omega-3, very good for our cardiovascular system, but in some studies it showed that it actually prevents a rapid surge in the stress hormone. So it's a graded release of that stress hormone produced from the adrenal glands. Nuts, seeds, almonds, they're all good sources of healthy fats which improve our cardiovascular system. Almonds also have vitamin E, which have also been shown to have some benefit in resilience to stress. Oranges, we know vitamin C, they can help with our immune system, and oranges contain a lot of vitamin C, but they also have shown to dampen some levels of stress as well. Obviously, these are taken from the sources that I've read about, but everything needs to be considered in moderation. Complex carbohydrates help to stabilize our blood sugar levels, and some studies have shown that it increases serotonin levels, which is our happy hormone. So pastas, porridges, oatmeals, things like that are very, very good for us in that context, but obviously in moderation again. Black tea. So black tea has an antioxidative property, so antioxidative stress property, and it showed in some studies, more with rodents and animals, that it reduces the inflammation around the aorta, one of the main arteries that comes out the heart. Folic acid. So folic acid deficiencies can cause us to feel tired and so forth. And so replenishing our folic acid stores may give us more energy, but also some studies shows that having good levels of folic acid may help to reduce some symptoms of depression. Now, I don't know whether that is depression because of reduced energy levels, they will pick them back up, and depression can cause a reduction in energy levels, and that's why folic acid works. But just in generalization, folic acid levels can help with some symptoms of depression. Water, so maintaining hydration is very good at keeping our stress levels as low as we can. There is a lot of literature on there on Google and PubMed, and lots of research as to what level of water we need to drink, how many cups of water. Generalization in the UK is between 1.5 and 2 litres, but there are lots of other studies showing far more water consumption than that. But I think from a clinician's point of view, if you notice that the colour of your urine is just slightly off clear, so that's slightly straw coloured appearance, that's what I would consider to be adequately hydrated. Please remember that, again, everything needs to be taken into moderation. So exercise, how does exercise help with your ability to cope with stress better? Well, it promotes endorphin release. Endorphins are feel-good hormones, so they make you feel better. It mimics the effects of stress in a controlled way. So with stresses that happen around us, we can't control them, and our body reacts to it, react to it in that way. And stress, when we undergo exercise, is a form of recreating that stress through those mechanisms we talked about earlier. But we can stop them at any point because we can stop exercise at any point. And so this is a way of our body practicing of how to deal with stress and gently calming the stressor down. And by doing that, our bodies will be used to the physiological responses. And so when we come across stresses in daily life, it's already used to that system and used to the practice, and therefore it helps us to cope with things in a slightly more calmer way. It can help you to distract. So if you're doing a particularly strenuous exercise, you may stop thinking about anything worrisome that's happening at home or at work. Reduce or release muscle tension. So when you go through exercise, all that built up tension and so forth, you overexert yourself, and then afterwards, because you've been using your muscles so much during that workout, you get a sense of relaxation, and that can release some of the muscle tension. That's why things like physiotherapy can help with muscle tension. But it's very good at releasing that built-up, pent-up tension that you can get with chronic stress. Improved self-confidence. So you might have goals. You want to run a marathon, you want to run half a marathon, you want to complete a 5K run. And once you attain those goals, you feel better about yourself. So it's improved self-confidence, which makes you feel better. And it can also help improve sleep because it can increase your fatigue levels or induce sleep. So how can sleep help with stress? So studies have shown that when you have a lack of quality sleep, so quality sleep would be REM sleep or rapid eye movement sleep, which is the part of our sleep that helps us to dream. And what shows is that if you have more REM sleep, I think it's about 20-25% of our sleep should be REM sleep. That helps to refresh ourselves. But in terms of stress, a reduction in sleep can have a negative impact on how the HPA axis reacts to stress. It becomes dysregulated. The negative feedback doesn't work as well as it should do. The body's ability to produce the stress hormones is not in proportion as what it should be doing. So it's a bit all over the place. So it can cause a lot of imbalance in that axis. Once particular study showed that a group of people who had a maximum of 4 hours of sleep per night for at least 1 to 7 days had a reduced amount of stress hormone in the mornings, so they didn't feel quite as alert as they would normally be. They had increased stress levels in the afternoon and a reduced reactivity and slow recovery to an increased level of stress hormone. So recurrent short sleep is associated with an adverse secretion of the stress hormone. Well, in terms of how much sleep do we need? Generally, across most studies, it's suggesting between 7 and 9, but it depends on ourselves individually. Some people can cope with 5-6 hours and they're absolutely fine. They have good amounts of REM sleep. Some people might need more than 9 hours. So there's no set recommendation anywhere, and most governing bodies have their own recommendations. But generally speaking, 7 to 9 hours is what most health bodies do recommend. Taking one step further with epigenetics. So what is epigenetics? if we look at ourselves and our makeup, so we all have a genetic code which cannot be changed, but we have a coating on top of that code which is influenced by the environment around us, and that coating switches on or switches off certain genes. So the way I like to describe epigenetics is by looking at the crossroads example. So in the crossroads, if all the traffic lights were turned to red, yes, there wouldn't be any accidents, but it wouldn't be efficient. You'd have traffic backing up, no one would be going anywhere. Similarly, if you had all the lights turning green, it would be chaos. You'd have cars going from all directions and the risk of accidents goes through the roof. So what we need is a set of coordinated traffic lights to turn red and green at certain times to help work in a more efficient way. And that's how I see the coating of the genetic code. It's turning genes on and off so that it makes ourselves work the best way possible. And by looking at which genes are on or switched off, which we can do with a simple test, we can then look at individuals, have a tailor-made lifestyle recommendation to say, well, these genes seem to suggest that you have a higher risk of developing heart disease, or these genes suggest that at the moment you have a higher risk of developing, increased suicidal ideations from stressors. What we can actually do is to look at how we can modify those epigenetics through your lifestyle by giving you specific advice, and then testing it 6 months down the line to see if it's made a difference to the epigenetics. So it's a really, really interesting new field. And the way to do or gain access to epigenetic testing, ToHealth does have a service. It's using world-class laboratory facilities. Again, this is kind of cutting-edge stuff. And it's a saliva sample you take at home and you send back to ourselves, and the laboratory will get the results to you fairly quickly. So in conclusion, I hope you found this talk useful. The aims being to look at what the biochemical responses to stress, what the effects of long-term stress are on our bodies, and how our lifestyle can improve our stress levels. So the stress is usually a protective tool, but if you carry on having high levels of stress, it can be harmful to our health. A balanced diet can help to improve our stress levels and also reduce the risk of those health problems that can be associated with long-term stress. Exercise can help us with coping with stress by mimicking the stress response, and so our body practices how to react to stress. Sleep is helpful in regulating our stress hormone levels, and epigenetics can give a tailor-made insight on how we deal with stress individually at a genetic level. Those are the references I used for this presentation. Fantastic. Well, thank you for your time this morning, and that ends today's presentation.